This chewable tablet is a combination of vitamins and iron, which is used to address or avoid vitamin deficiency caused by inadequate diet, specific illnesses, or pregnancy. Vitamins and iron are essential for the body and play a crucial role in maintaining good health. Make sure to chew the Pediatric Multivitamin No.239-Ferrous Sulfate 10 mg chewable tablet thoroughly and then swallow it. You should take it once a day, following the directions on the product package or as directed by your doctor. It's important not to take more than the recommended dosage. For best results, take this medication on an empty stomach, either 1 hour before or 2 hours after meals. If it upsets your stomach, you can take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can make it less effective. In order to get the most benefit from this medication, take it regularly at the same time each day. Remember, if you have any questions, it's best to ask your doctor or pharmacist. When taking Pediatric Multivitamin No.239-Ferrous Sulfate 10 mg chewable tablet, some common side effects may include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to notify your doctor or pharmacist. You may also notice that this medication causes your stools to turn black, which is a harmless effect. Although very serious allergic reactions to this medication are rare, it's crucial to seek immediate medical help if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned, it's advisable to contact your doctor or pharmacist. As for the best time to take this medication, it's recommended to follow your doctor's instructions for the daily dosage and timing. If you have any concerns or questions about when to take this medication, be sure to consult your healthcare provider for personalized guidance. It's important to keep Pediatric Multivitamin No.239-Ferrous Sulfate 10 mg chewable tablet out of the reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's crucial to seek medical help right away or call a poison control center. This multivitamin with ferrous sulfate is beneficial for children who need to supplement their diet with iron and other essential vitamins. The recommended daily dosage for children is as directed by a healthcare professional. It's best to take this medication at the same time every day to help establish a routine and ensure consistency in the child's supplementation. Before taking this pediatric multivitamin with ferrous sulfate, it's important to discuss any allergies with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions. It's also important to share your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, it's crucial to inform your doctor or pharmacist if you have vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency may result in serious nerve problems. This medication may also contain aspartame, so if you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. It's important to be aware of any potential drug interactions with Pediatric Multivitamin No.239-Ferrous Sulfate 10 mg chewable tablet. Some products that may interact with this drug include chloramphenicol and methyl-dopa. Additionally, this product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of this product. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. If a person takes too much of this medication and experiences severe symptoms such as fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It is important to keep all medical and lab appointments. Please remember that this chewable tablet is not a replacement for a proper diet. It's always best to get your vitamins and minerals from healthy foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines recommended by your doctor. If you are taking this multivitamin on a prescribed schedule and forget a dose, take it as soon as you remember. If it is close to the time of the next dose, skip the missed dose and take the next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Pediatric Multivitamin No.239-Ferrous Sulfate 10 mg chewable tablet, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's out of reach of children and pets. And when it's expired or no longer needed, be sure to dispose of it properly by consulting your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.